Good afternoon, everyone, and thank you for joining us for our first in a series of Q&A sessions with members of the medical staff here at Norley Hospital District. And guys, we're really blessed today to have Dr. Simon with us. Dr. Simon is a family practitioner at the Hobbs Medical Clinic, and he's a busy and popular guy. Dr. Simon, thank you for being with us today.
Thank you for having me, Dave.
Great. And today what we hope to do is try to answer some of your questions about COVID-19 and this pandemic that we're finding ourselves in all across the country. And there's a lot of misinformation out there, and so today we really want to get the truth out there and clear up some of those myths and misnomers that are out there. Please submit to us any questions that you might have during the presentation, and at the end we'll try to get you some answers today. So, Dr. Simon, let's just jump right in, and I think we'll start with an easy question. What is COVID-19?
So COVID-19 is the name given to the disease that's causing the 2019 novel corona outbreak that was first shown in Wuhan, China.
So it's a virus, not a bacterial type infection?
Yes, sir. So it is a virus, which means antibiotics don't work against it, and at this point there is no vaccine for it.
Okay, all right. So what are some symptoms that an individual might be looking for that would indicate that they might have it?
So commonly the symptoms that you would see with this virus would be fever, shortness of breath, and cough. Those are the most common.
Okay, so if I have those symptoms, should I jump in my car and head to the emergency room or go to a clinic?
Absolutely not. The number one thing we're trying to do with this is to prevent exposure to others. So if you have those symptoms, we would like you to either call your physician or call this COVID hotline, 575-396-9090, and you'll speak with a provider there, and they will be able to guide you on what's the best course of action, whether you need to see your private physician, go to an urgent care, come in for COVID-19 testing, or go to the emergency room.
Okay. And one of the things, as I understand it, Dr. Simon, when they get to the screening center, there's a healthcare professional there. They'll do an in-depth questionnaire. They'll do vital signs. There's a chance, though, that if they don't have the symptoms, that they won't be tested. Is that correct?
That's absolutely right. We only want to test those that we have a high suspicion for.
Okay, very good. So if when a healthcare provider identifies a positive patient, how do they work with the Department of Health to investigate that situation?
So anytime there is a positive test, an epidemiologist with the Department of Health works with infection control to investigate the potential contacts and takes the appropriate steps to ask those contacts to self-isolate and to be tested.
Great. And just from my experience here in Lee County with the one case that we're familiar with here at Norley, I know that the Department of Health went in, questioned a number of people, had individuals self-isolate that needed to, and so it was a very comprehensive investigation to ensure that the public was protected. So kind of related to that, you know, it's a challenge for all healthcare providers, but why is it that we can't make that patient public?
That's very important because we have privacy laws called HIPAA to protect a patient's identity. But you know, when there is a positive case, those that are caring for the patient and dispatchers are notified to protect first responders from unnecessary exposure.
Great. And I know that that's really important because if you're a first responder, a paramedic, and you get called out and it's one of these individuals, you need to have your protective equipment on so that you don't get exposed.
That's absolutely right.
Great. So we hear a lot about COVID-19. We hear that the vast majority of people that contract it have mild symptoms, but then there's a category, age 65 and older, those that have underlying healthcare conditions that seem to be at greater risk. Why is that?
So if we look at all the cases around the country and around the world, it's, you know, people who have a higher risk of having a poor outcome from this are people who are 65 and above, and those with underlying medical conditions, things such as diabetes, hypertension, any kind of underlying lung disease, whether it's COPD, asthma, and then also those with an a decreased immunity.
Sure. And so it's really, I think, imperative or important for us as the public to really look out for those individuals and to protect them.
Absolutely.
Yeah. So we hear a lot, especially we hear about this in New York, and we're beginning to hear a little bit about this in Northwest New Mexico, about this idea of a surge hitting hospitals and overwhelming the resources of a hospital. What would a surge look like here in Lovington?
So what a surge would be a great increase in the number of COVID cases. And with that, you will have an increased number of patients that will need hospital support, whether it's just supplemental oxygen and other supportive therapy in the hospital or ventilator support. And the more cases we have, the higher risk we have of those having more cases that will require these things. And we, being in a small town in a small hospital district, we will get overwhelmed very quickly if that happens.
Right. And one of the things that Dr. Simon, as our chief of staff, participated in this earlier this week was approving our surge plan for the hospital. And so a lot of our nursing staff that work in the clinics have been cross-trained now to work in the emergency room and on the floor. We also have started cross-training our physicians. In fact, Dr. Simon is cross-training to work on the floor as well. So the hospital will be well prepared for the surge when it comes. We have 21 beds. We've now increased that to over 30 beds to be able to take care of folks. And I think, Dr. Simon, it's difficult right now for those of us living here in Lee County to really wrap our minds around the idea of a surge. I know it's even difficult for me as the hospital administrator, but we were on the phone earlier today with the Department of Health, and they're projecting this surge. And they're actually predicting that by the end of April that we will run out of available ICU beds across the state. And that by the 1st of May, there will not be enough hospital beds to care for all the patients. And I think that gives us pause when we hear that. And so it's so important that we get prepared, and so proud of our medical staff and proud of our staff for the work that they're doing to get prepared for whatever may happen here in Lovington. We may not actually see a surge per se here in Lovington with COVID patients, but we are going to do our part to help the rest of the state in whatever that might look like when it comes. The governor has issued a stay-at-home order. Why is that important for us to follow?
I think this is hugely important, and I think it's something that we all need to really respect and adhere to. Staying at home, the key to preventing this surge is to decrease the number of cases. And the only way you can decrease the number of cases is to decrease the number of exposures. And if you're staying at home with your own nuclear family, you're decreasing your chances of picking up this virus from somewhere else and then spreading it to others.
I think that's a good point. And again, by doing that, we lessen or prevent a surge here locally.
That's exactly right.
Would you say that folks here in Lee County are doing a decent job?
I do. I have to give a lot of credit to everyone in Lee County. I think most of the people are adhering to this stay-at-home order. It's difficult. We know, it's not easy to stay at home. We all want to be out and about doing things, but it is for the greater good to do this.
So we can't stay at home 24/7. We have to go out and buy milk and eggs, and my wife's probably going to go crazy if I'm home all the time. So she's sending me out to get things. What can I do to protect myself? What can you do in those situations where you do have to get out into the public?
I think it's very important that we take certain steps to protect ourselves when we're out in public. And one of the biggest things is going shopping or going anywhere. You should use one person in the house to go out. Not everybody, the whole family shouldn't be going, and you should really use the same person to kind of limit the amount of exposures. The other thing is when you are out in the store and out in public, wearing a cloth mask is very important. It helps to prevent the spread of this disease. You know, you don't need to use an N95 respirator mask, and you don't need to use surgical masks. Those should be saved for healthcare professionals. You know, but a cloth mask is very well. The other thing is, you know, covering your sneeze. You know, if you're sneezing or coughing, cover it up. You know, look out for others around you. You know, and keeping that social distance of at least 6 feet away from each other will really help.
Very good. So, bottom line, what can I do to prevent getting this virus?
So, you know, prevention is crucial with this virus. And, you know, right now, currently, there's no vaccine for this virus. But, you know, the best thing to prevent getting this is to avoid the exposure to the virus. So the virus is thought to spread but through respiratory droplets. So washing your hands often with soap and water for at least 20 seconds. If soap and water is not available, then using a hand sanitizer that contains at least 60% alcohol is acceptable. Avoid touching your nose and your mouth and your eyes with unwashed hands. Avoiding contact with others. Staying at home as much as possible. And keeping at least 6 feet away from others is important. You know, covering again your nose and mouth with a mask, a cloth mask is important, but it should be a cloth mask and not the N95 mask or the surgical mask. And then, you know, cleaning and disinfecting highly touched areas is hugely important.
You know, Dr. Simon, the medical staff and the executive team, we had a discussion today, and we're really starting this next week are going to promote the wearing of the cloth mask in Lee County, even encouraging our employees to do the same, because I think it's just another step of protection for ourselves and for each other. Dr. Simon, do you have any final thoughts today?
You know, I think in these trying times, I think it's really important that we all try to help one another during this time. And, you know, by helping one another, it's keeping the social distancing. That's hugely important, because that not only, you know, this is very important. What we do right now affects not only ourselves, but everyone else in this county and in our community. So I think social distancing is paramount, and then trying to do your best to, you know, help one another, help out your neighbor if you can.
Yeah, great advice. And you know, I just feel really blessed to live in Lee County, and the people that we interact with. Just in the last few days, just some of the things that have happened. Last night, the community came out in large numbers to show their support for the hospital and to pray for us as we go through this pandemic together. We have volunteers throughout Lee County that have made over 8,000 masks, and they're planning on making more. It's just great to see the community coming together to support us and to support one another. And I think that's the key to get through this, is all of that support in the county and working together to protect one another. I think we have a couple of questions that have come in. I have a couple right here. One question that we had from a viewer is, how are you handling your appointments at this time? That's a great question, because things are changing.
It's super important. Yeah, right now the governor has cut us down to only essential visits in the office from 9 to 1. And this is again to prevent exposures, you know. And the other patients that we're, you know, the other appointments that we have, if we can, we are doing them either by video call or telephonic call.
Great. And next week in our Q&A, Dr. Nelson, our neurologist, will be joining us, and we're going to go into a lot more detail about televisits next week, so look forward to that discussion. Another question we had is, what precautions do I need to take as a type 2 diabetic using an insulin pump?
So being a type 2 diabetic, again, we're at a higher risk of severe outcomes from this virus. So social isolation, hand washing, not touching your face or your eyes or your mouth, and, you know, really preventing your exposure to this virus.
Great. I believe do we have any other questions, Jordan? How many cases do we have in Lee County? So we do have resources that you can look at on a daily basis that are at norlee.org, and you can click on the Department of Health link that's located there, and we also update that page at the end of each day. But right now, there are have only been 2 confirmed cases in Lee County. So we're very blessed in that. Does the virus thrive on ibuprofen? I'm going to turn that over to you, Dr. Simon.
So again, this is another question that comes up a lot, but the information, new things are coming out every day, but as of right now, from my best knowledge, that ibuprofen does not cause a severe illness. It doesn't make this virus more severe using ibuprofen.
Okay, great information. I see we have another question. How many vents does Norlee have? That's an excellent question. And the hospital district typically does not manage patients on a vent. We have vents that we use in temporary situations where we're managing a patient that needs to go to a higher level of care before they get transferred to another hospital. But we do have anesthesia machines, and those can be used as vents. And currently we have about 5 that we could use. And so in our surge plan, our plan is to turn the OR into an ICU where we can manage patients on a vent. However, as of today, Covenant specifically has 150 beds available. So our plan is, if we have a patient that is that critical, it's really more appropriate for them to be transferred to a higher level of care where they have physicians and nurses that are experienced in managing patients on a vent. But that's an excellent question. We are prepared if it gets to that point. If my Lubbock doctor orders lab, can I still come into Norlee to get my blood drawn? Absolutely. So you have 2 choices. If you live in the Hobbs area, you can go to the Hobbs Medical Clinic. There's a draw station there. Also here at the hospital. Now, when you come to the hospital, you're going to go through a screening. They're going to ask you questions. They're going to take your temperature. The reason why they're doing that is we want to make sure that nobody that could be at risk of having COVID-19 enters the hospital. So there's a little bit of a hassle to get into the hospital, but that's for your protection, but we absolutely can continue to do your lab. What about our every 3-month appointment? Well, for right now, if it's not essential, Dr. Simon, we're putting those off. Is
Yes.
that correct?
Or we're doing a telephonic visit if it's important.
Right.
So
So I would encourage you to call into your provider and have that discussion with them, and they'll decide if it's appropriate to do it by phone or to put it off for a period of time. Well, it looks like that's all the questions today. Guys, I really appreciate you tuning in. I hope you found this Q&A session helpful, and I look forward to the one next week with Dr. Nelson as we discuss our telemedicine project. Thank you.